Okay, everybody. Are we live? Okay, great. Well, welcome everybody. I am really excited to be hosting this panel. I'll give everyone a few moments to settle in. First, happy Black History Month. Let's just start there. Can we get a little roll call in the chat while you're coming in to say, hey, who are you? How's everybody doing? I'll start in about 30 seconds. Happy Black History Month, everybody. Okay, so welcome everybody. We are here as a roundtable. It's really important. I was really excited to get to know some of the panelists here because we not only have doctors and doulas doing the work on the ground, but who are we doing it for? We're doing it for the patients and the people in our community, probably the people that need it the most. So I am honored to, first of all, be here today, be here with everybody, and ask some really important questions. It's going to be a really jam-packed session. We have about an hour. I'm going to be introducing the panelists pretty soon. And we have a really good selection of questions that I'll be asking everybody. And then we will open the floor to questions. So try to make sure that you write everything down so you can get all of your questions in. And I'm sure this conversation will continue after. Um, I think the first thing we should do is talk about who is here. And so I'm going to go down our list, and I'm really excited to first introduce one of my colleagues. It's actually so cool to say that I have colleagues now because I just graduated from residency, but I want to start with Dr. Taylor, who is a board certified OBGYN, and specifically reproductive justice advocate. I don't think a lot of people add that specific part to their role because most people opt out. And this is actually some of the most important work that we do in our field. So thank you, first of all, for making sure that you're including that in what you're doing. She is the founder and CEO of Desert Start Institute, which is a family planning clinic in Phoenix. And it encompasses everything: sexual health access, abortion services, education, and including policy advocacy. Welcome, Shariah. Um, she has a recent latest work, Beyond Choice, an essential workbook for personal and community transformation through reproductive justice. And it is like a transformational guide on how to take reproductive justice off the shelf and make it a reality. So thank you so much, Dr. Taylor, for being here. Next, I'm going to introduce Ms. Nandi. So I just learned in our little kind of practice session behind the scenes that not only is Nandi a doula, of course, in birth and postpartum work, but she also does abortion doula services. And that is so special. That is so needed. I wish I could have this as a mandatory practice, because this is all a part of a woman's health life. And so thank you so much for being here and doing multiple parts of the job, and also like introducing us to what doulas could do. And she's committed to reproductive health and justice space, and specifically, of course, focusing on our communities. So thank you, Nandi, for being here. She's also a mom of two, and I think rather importantly states that has had multiple abortions herself. So thank you so much for being here. Now, we do this work and we do it for people that deserve it the most. And unfortunately, we have women here who have been important in speaking about their daughters' fights for their life and practices that should be standard, practices that should not be limited. So I want to introduce two very important people. The first person, Shanette Williams. So this is the mother of Amber Nicole Thurman. I'm sure you all have heard this name on the news. And thank you, Ms. Williams, for being here and speaking and holding the truth for something that we all kind of hear about, but we don't see and we don't feel and we don't realize these are our daughters, our mothers, our aunties, our cousins. If you don't know who Amber Nicole Thurman is, she was a Georgia woman who lost her life to two-state abortion bans. This has been stated that this was a preventable death while experiencing complications from a Med AB, which is overall a very safe medical procedure, or sorry, medical treatment. She was forced to wait for an incredible amount of time before they performed a routine D&C or something that should have been routine when there was obvious complications. And unfortunately, Amber's life passed away. And so since Ms. Williams has been fighting for her daughter and for justice and to put a face and reality to the name that I think sometimes you only get with the person that you're doing it with, and you don't realize like this could be any of us. So thank you for being here. Our last guest that I want to introduce is Mr. Rai. Thank you so much for joining. Not mom, but older sister of Candy Miller. I'm sure you all have heard that name as well, if you have not. Another preventable death in the state of Georgia, if she would have received timely abortion care. So this happened in 2022. I remember this very vividly, and she decided to seek this kind of care on her own, but she had a lot of medical conditions, and it should not be this difficult to just get someone to take care of you. It was deemed a preventable death blamed by the Georgia abortion ban. And then just a quick intro about myself. I'm Dr. Evans. I literally just graduated from OBGYN training. So I'm in my first 4 months of doing this all by myself as a big girl. It's quite terrifying, but I realize the more every single day that I show up, I'm needed, I'm wanted in the way that I do it. I'm a Black woman that owns it and understands that although this work is extremely hard, I cannot walk away because it's needed. And I'm one of those people. I care about justice and doing it in a way that makes people feel comfortable through some of the most vulnerable points of people's lives. And I wanted to set the tone. Actually, it was something that when I was asked to do this panel, I kind of thought about myself as I was learning to become an abortion provider, because I do provide abortion. I'm one of the newer doctors in the practice that have already, just I think 2 weeks ago, was able to get mifepristone and meso on our roster, which we never had before. And we have 4 girls that are now committed to do abortion care and providing. So I'm like, I went in and we just did it. But it wasn't this way before. When I was a second year OBGYN resident, I remember getting called into one of the most significant patient interactions that I had that changed my entire career and outlook on abortion care. And I weirdly got asked to be a part of this book project called the Good Listening Project, where they ask OBGYN residents kind of like about their lives. And it was a healing project. And she wrote a poem in response to me learning how to do abortion care. And I wanted to just share a few kind of paragraphs to set the tone for what we're about to start today. So the poem that it ended up being was called Good Hands. Have you perfected a repeat C-section, a vaginal twin breech extraction, a midline vertical skin incision? Are your visits logged? Are patients roomed? Are the vitals in? Good hands aren't attached to a robot. They're never reduced to executing tasks. Good hands make space for stories, and then they listen. Good hands know there's no rule book. Instead, dig deeper for an honest look. Good hands are Black mentoring hands. Good hands do what they haven't been taught. Good hands cup tiny feet and cradle chests. Good hands comfort wailing mothers and offer what she needs for closure. So I think weirdly, as we're talking about this from like a macro, we're also healing in this process, because I think everyone here has been intimately in those rooms that no one else, they read about it, they hear the stories, but we've been intimately involved. So I want to offer this also as a space of healing. And I hope that you all know that we do this work for you, Ms. Williams. We do this work for you, Ms. Taraya. So thank you for being here. So I know that Taraya has to leave a little bit earlier, so I'm going to make sure that, if you feel like you want to answer any of these questions, please hop in first. Okay. I think one good place to start is looking at a study from the National Partnership for Women and Families. 60% of Black women experience economic insecurity, and they live specifically in states that are affected the most. And it always becomes an economic question when it comes to abortion care and the funding of it. But then when you see that it directly ties into who lives in these states the most, we do see the correlation between this and higher mortality rates, higher morbidity rates for things that are very routine in our practices. So how did these kind of realities affect Black women's access to quality, affordable medical care, and the impact nationwide? But I actually think, Tarai, you kind of may want to hop in on this because this is something that's really important in terms of your sister's story. But this is also a question open to everybody. So the specific question is, how do these and other hurdles that affect Black women's access to quality, affordable is a real important question, medical care, and how does that impact our maternal morbidity and mortality? Oh, wait, we can't hear you. Can anyone else? No.
Let's see. Can you hear me now?
We can hear you.
Okay. I'm actually in the hallway of.
Oh,
Hi,
I'm
Shanae.
sorry.
I just want to acknowledge someone that I haven't had a chance to speak to in a while. Shanette, you're dear to my heart. I love you. I miss you. I know that, we've kind of been silent, but I just want you to know you're always in my heart. I love you always, and I'm forever thankful. So yeah, and thank you all for having me today. I would like to answer that question by saying that I'm sorry, can you repeat the question?
Sure, no problem, no problem. We're basically making it very clear and kind of saying it out loud that where these abortion bans are the most coincide to Black women and where they live, specifically when it comes to trying to find affordable and quality care. So how does these things affect our daily lives as Black women?
Well, I would say on behalf of my sister, I know that if she had had access to a healthy, viable, reliable source, she would have taken that. And I think there's a stigma around it. And she ordered the pills for herself online, and that was her least expensive alternative.
Yeah.
She was afraid to go to the doctor. I mean, she already had a history of hospitals and they weren't favorable. My sister suffered from lupus, high blood pressure, diabetes, and all of the things. And, she spent a lot of time in the hospital due to lupus. And she'd had a miscarriage actually before then. And I think that one of the stigmas was that she already had 3 children. And with her health being on the line, she opted to take care of it herself. And if she had had the resources, she would have gone. She could have come to me because I actually live in Kansas, a state where it is legal. But I think it was something that she was keeping to herself and wanting to rectify herself. And so she took the route of taking the pills. And, she was naive and not knowing the consequences of, the pills doing their job. It wasn't the pills that killed her. The pills did what they were supposed to do. She just did not, I guess, understand the ramifications of not expelling all of the fetal tissue. And she ended up passing from sepsis because she was afraid. I mean, she had mentioned this multiple times to myself, and she was like, I'm not going to jail, but yeah, she thought that she would go to jail because that's what the Georgia law said, that, if you go to the hospital for an abortion, you could end up in prison. And just to kind of piggyback on that, if she had gone to the hospital, there's still no guarantee that she would have gotten the services she need, as we know from Amber's situation and what Shanette is going through. She sat there with her daughter, so not knowing everything. So I think that just education, lack of access to that contributes more profoundly to people of color.
Yeah. Thank you so much for that. And it's there's so many roles here though. Like education is one thing, but it really is feeling safe when you
Yeah.
get to the hospital. And I know that there's misinformation going all the way up and down the chain. So sometimes it's not just the OBGYN, it's the nurse anesthetist that doesn't want to partake. And now that throws off the whole equation and we need to wait another shift. There's truly misinformation top down that becomes continued roadblocks that delay care. Um,
I'd like
Shit.
to
Yeah.
add
Yes.
to that.
Mhm.
Oh, Shanette can go next. That's fine. But I
No,
do
no,
want to
please.
add to that.
Yeah, please, Dr. Tay. I think this is a good time to add to that, and then we can go to Shanae.
Okay. So a couple of things that were on my mind related to this question is that at the federal level, these attacks exacerbate the maternal health crises, and we know that communities that are already marginalized and have difficult access to care are going to bear the brunt of those. So we're having these situations where we have so-called maternity care deserts. And so when abortion is criminalized, the OBGYNs flee those states. We are seeing a mass exodus of providers from rural and marginalized areas. Clinics are closing. And we know that when clinics close, the community lose its primary source of care, screenings, contraception. And so I think that, there's this idea that, we are supposed to just stay and be criminalized in these states. And I know was on a panel at a conference where a woman from Alabama was rightfully angry, and she said that doctors were abandoning her. But my thing is, we got trained to exercise the full breadth of our training and experience and not to go to jail. And so, although, I'm in a state that has gone back and forth with bans, and I push the envelope as much as I'm comfortable, at the end of the day, I'm not trying to go to jail. And that creates a chilling effect. When, like Taraya said, even if her sister had gone to the hospital, would she have gotten the care that she needed? And, in this hostile environment that we're in, we've seen over and over again that the answer is actually no. And as an OBGYN, I couldn't stay in a place where I wouldn't be able to use my life-saving skills for somebody. Like I would move too. And so it's a very unfortunate situation that we're in. And then we have the EMTALA situation where, they're trying to say that that emergency rooms cannot take care of pregnant people in emergent situations. And so that's like the last stop for somebody who's trying to get their life saved. And they can't even trust that that'll happen in the emergency room. So we really created a very hostile situation for people to be pregnant, and it's costing lives.
Yeah, I really, that last line of it's just hostile. It's hostile from all angles. And then in these maternal deserts, it's getting really scary. And then you have to look, how does this look in the next 5 or 10 years? Like we are just getting started with this overturn and knowing the consequences really down the line. Shanette, I'm gonna give this opportunity for you to kind of speak to what does it feel like when you were there trying to get the care and it still didn't happen.
Yes, Dr. Evans, thank you for creating this safe space and the panel in order to talk about these disparities. I want so badly, and I pray about this every single day. I want so badly not to have hatred or anger towards doctors. all because Amber's situation was totally different. You had the opportunity to tell me what was going on. And not every doctor, but those particular doctors that were over my daughter's care. You had the opportunity to tell me, and you neglected to do so. Literally, I felt like they just played in my face, stringing me along, telling me, we're going to get your daughter taken care of, but we got to make sure the vital signs, we got to make sure this is good, we got to make sure that is good. When all at the same time, the only thing you had to do was talk to me as a mother, but you treated my daughter as if she was a statistic. And on that day, the only thing I can reflect on is sitting there, waiting and waiting and waiting until my daughter finally said, Mom, this is painful. It's too much pain. And I am being the doctor's cheerleader, telling her, you're going to get the best of care. You're in the right hands. You're where they're going to take care of you. But that was far from what they were doing. And I would have never known had this persistent journalist almost beat my door down, even years after, to tell me, to literally almost shake me, to tell me, you have to hear what happened. Because if you don't, you'll never know. And when she began to tell me, I'm going to interview other people. And at that point, something arose in me saying, wait a minute, no. I was pulled in late when my daughter was going through her what brought her to the hospital. And no way I'm going to let strangers talk about my daughter without me being present. And when I found out with the world what really happened, Amber didn't just die. She was killed at the hands of people that took the oath to do no harm. She didn't go to the hospital and she was near death. She went to the hospital because she'd already taken the pill. And the only thing they needed to do was do a 20-minute procedure. And nobody would have known me because Amber would still be here. But instead, they made a decision and treated me as if it was okay for them to decide to not care for my baby. And that is why we're here. So what do we look like? How did we get here? We got here because politics is playing a role in healthcare. And it just does not work. It doesn't work. People, absolute strangers, are telling doctors, you cannot treat this patient because if you do, this is what's going to happen. So the doctor-patient relationship is broken. The system is broken. And this is why we're here today. And I pray every day that God helps me not to have that hatred in my heart, because guess what? My daughter too will never know that she was accepted into nursing school. A year from now, I will be a doctor going through my dissertation right now. So the people, the profession that I put my heart into has failed me. But all at the same time, I still want to give my life for people. I am still advocating because I don't want another family that I can help in the future to go through what Taria, to what April Newkirk, Adriana Smith's mother, to what so many other women, family members, loved ones are dealing with because of these egregious acts. And that's where I am.
Thank you so much, Ms. Williams, for telling your story and even leading with, I was y'all's advocate and I'm trying. Like the fact that you're even still saying, like, I'm trying to believe in the system, but it is broken and there's politics and messy hands and dirty, disgusting realities that have nothing to do with what needs to happen. I'm curious, Nandi, if you could speak to us as an abortion doula. How would you speak to us right now? We're hurting, we're mad, we're angry, and we're trying to figure out how to do this, like do this work, be present. What words can you give us to help us through this? Because I feel like you have skills that are important in work that's important.
Yeah, thank you, Shanette, for sharing your story. I really appreciate it and for you being vulnerable in this space. Um, I want to say that grief is challenging in every facet of life, especially here. And one thing I always tell my families that I work with who have one either experienced a loss or are going through or deciding to have an abortion is that grief is not linear, and you are going to grieve every day for the rest of your life. Grief starts to look different as the days and the months and the years go by, but that grief it stays with you. And so finding your practice, finding your community, finding your support is really important. When we're grieving and in the thick of it, sometimes we don't take the best care of ourselves, meaning we're not eating, we're not talking to the people who actually love us and want to see a smile on our face again. We're not letting the sun see us. So we're in the house, curtains are closed, blinds are closed. And those things, those two things, support and the sun, are super duper important as you heal. And so my words to everyone is, as you go through anything in life, but especially here right now, is to make sure after we leave this call, after we leave this panel, that you spend time with people who love you, you get some sun, you eat something, particularly something with protein in it, and help you get your energy and just love on yourself. And I know self-care is all over the place. I don't talk about self-care. I don't care about that. I'm just going to tell you to get some sun, get some support, and make sure you eat something. I don't care if it's a piece of toast with a boiled egg white. Eat something small so you can continue to do the work. Rest and then get back at it. Everybody here has continued on after things are hard, especially everyone who has completed a degree program, who has had children and raised children or supported their siblings. We've all gone through really challenging things. And so being here today is a testament that we can continue on.
Thank you for reminding us. Sometimes I see patients and they're distraught and we're talking about mental health and all these things. And then I'm like, have you eaten? How many hours of sleep did you get last night? Like the true basics of keeping ourselves just strong and healthy through this process. I kind of want to redirect back to Raya, the older sister of Candy Miller. I wanted to ask, tell us about Candy. I would love to know just more about her, who she was, um, who she is, so that we can really honor her in this time.
Anytime I have the opportunity to talk about my sister is a blessing, which is every day. Candace was my baby sister. She was the spark of the family. She was the light. She was the fighter. She was the warrior. And I feel like when she passed away, she left her spirit with me, a part of her spirit with me. And I'm grateful to be able to share her story and tell who she is. Just like Shanette said before, I wouldn't have known the cause of her passing. I thought it was related to lupus. I waited 6 months almost to get her autopsy information, which I think is telling in itself. But it was stated natural causes. So my sister Candace was just like the spark. She was the baby, and she was the one that if you needed somebody to have your back, you went to Candace. She was the smallest one. She was 4'11", but she had the strength of a giant. And so everybody called on her when they needed a voice or needed somebody to stand up for them. But with all of that fire and light that she was a solitary person. She had a small, tight circle. So if you had a chance to call her your friend, you were truly her friend, because that was not something that everyone was privy to. But she loved her children. She loved her children so much that she would sacrifice, um, you know, anything for them. And as a mother who loved her kids the way I know she loved hers, when she was sick with lupus, she trusted me with her two children at the time. And, she ended up having another child. And, just to kind of talk to her spirit, a few months before she passed away, she was like, sis, I'm not going to be here long. So she was kind of like, she always knew things before they happened. And she was like, I'm not going to be here long. And I was like, no, you're young. You can fight. You can get through this. And she was like, no, I'm not going to be here long. And she just kind of ignored me telling her that she was going to be okay. And she said that she wanted to make sure that her baby, Genesis, was taken care of. Because at the time I had cared for her two older children. And I promised her that I would. And it was a relief to her knowing that she didn't have to worry about me taking care of her baby. And she passed away 3 months after that, not knowing the cause. I mean, I don't know if she knew how she was going to die or what have you. I mean, she had fought lupus for, at that time, the last 7 years, because she was diagnosed after she had her middle daughter, whom she named after me. She looked up to me, but believe it or not, I looked up to her as well, because she had something that I didn't have, which was just this fire. And I have the fire now to keep going because of her. But she was a jokester. She was funny. Her stories would have you laughing. I mean, I can still hear her laugh now. But she was just a good person. She meant well, and she would give you the shirt off her back. And so that's how I want her to be remembered, as a light, as a firecracker, because that's what she was. And I do this for her three children. Christian is her oldest, and he's 18. He'll be graduating this year. And little Taria, we call her TJ. She's my namesake, and she calls me mommy now. Quick story: when my sister passed, the morning that she passed away, her daughter became really sick, and she came to my room and she was like, Auntie, I don't feel well. And she just had like aches all over her body. And she didn't know, I didn't know that she was sick, because she would never come to me and say, I'm sick. She would just kind of work it out. But I laid in the bed with her that night, and I heard a loud call. Someone said, Taria, like really loud and clear. And I thought it was my husband. And when I went back downstairs, everybody was asleep. And normally I would pick up my phone and just kind of look at it, but I didn't. It was like 4 o'clock in the morning. And I went back to sleep. And then around 7 o'clock that morning, my phone was just blowing up. When I picked it up, I had a bunch of missed calls. And that was the morning that my sister passed away. And I really feel like she was letting us know that she was leaving and that everything was going to be okay. And so I'm a spiritual and a religious person, and I just know that God gives us signs in different ways. And that's the power of my sister. So that's who she was.
Thank you so much. I can hear her, short, strong, fighting through lupus. I think me and Dr. Taylor have had these patients before where we don't want to leave their room because we want them to leave because they're better, but we've gotten to know them because they're so special. And hearing about her family and that morning, thank you so much for just sharing that with us. And I think sometimes, once again, we get really macro with these conversations, and I wanted to redirect the conversation just a little bit, but to not forget that these situations, these bans, they are all sitting in people's lives in their houses. Um, spiritually, I got chills when you told me about their story, about that morning. I also had a mother that passed away and distinctly felt the moment that she left our earth. And since then has been with me and has allowed me to continue to do work that I never thought I could. And so there was absolutely like little TJ, she has that with you.
Yes.
I can feel that, and we're just on a Zoom. So thank you so much for opening up about your family. When we
Thank you.
talk, yes, thank you. And when we talk about like the reality of these bans are stupid. Let's be honest. The in Georgia today, abortion is legal until a fetal heartbeat is detected. And when I tell you that is every single person that shows up at my door, and if you are 5 weeks, we are just kind of waiting for these hormone levels to rise, and we bear like it's just ridiculous. This is the reality of the abortion bans that in Texas as well, nearly all cases of abortion are legal, except when their person's life is at risk. It's a very subjective statement. That's a very haunting statement. What does that mean? So maybe speaking to everyone else on the panel, why do gestational limits and quote unquote exceptions not work? Especially when we highlight who it affects mostly, which are Black women in these abortion states.
Dr. Evans, if I can interject, how
Yes,
many mothers on the panel even know they're expecting at 6 weeks? That's first thing. So to say that ban it at 6 weeks, you after 6 weeks, we don't even have a clue that we're expecting at 6 weeks. There's no detection. And so it's a major concern. It's almost like it's designed that is designed to put women in danger because we don't even know. I'm in my 50s, and I can tell you with every one of my children, I had no clue. And if we really want to get technical, sometimes you have to get that, you have to have blood work, labs in order to tell you that you're expecting. So
exactly. Complete misinformation
it's
and
misinformation.
exploitation of what is normal pregnancy care, um,
Yes.
and normal menstrual cycle. Like it's ridiculous. Dr. Taylor, do you have any thoughts about this?
Yeah, so what this what this situation has created for people is some people are like, well, I had sex. Now I'm taking pregnancy test after pregnancy test because the condom broke or I took plan B. And now people are like super vigilant about figuring out that they're pregnant because they know it's not the right time. And so they want to be able to get their abortion before it's too late. And that is a really unfortunate way to live as someone who is pregnancy capable, right? You want to just live your life, go to work if you work, take care of your children if you have children, and enjoy your life. But now there's this hyper vigilance around pregnancy, and it is stressful. The other thing about these 6 week gestational limits is that another aspect of this is psychological. Like if someone has a regular period, by that time, the period has been missed. But then there is this idea that, oh, it's just going to be late. Oh, I'm not really pregnant. So there's an aspect of this that someone who doesn't want to be pregnant in their mind, they're not. And so when we put these arbitrary limits, we are really creating again this hypervigilant state where people are so hyper focused on whether they can be pregnant or not that it's really impacting their daily lives, and it's just not the way that we want people to live. And we also want people to have time to process the fact that they're pregnant and take some time to determine what does that mean in their life and what they actually want to do. And in that regard, 6 weeks is not enough, right? And so we have people making rash and quick decisions when what they really needed is more time. And we want people to I'm an abortion provider for 25 years, and I want to perform wanted abortions. I want people to have the time that they need to process through whether starting a family or adding to their family or not is the absolute right decision for them. And a 6 week gestational limit does not provide people the opportunity for that.
And there is time, everybody on the panel, everyone that's watching, there is time to get an abortion, and it is something that is needed, especially in cases where you have lupus and you don't even qualify for a lot of the normal birth controls that we have allowed for certain patients. And so you are almost like between a really hard place and a really hard decision of what you're going to do as a reproductive age woman. I wanted to get an answer from Nandi as well before we kind of open up to the Q&A about why these 6 week abortion bans don't work. They literally, it's not an exaggeration. It does not make sense.
Right. So I support, of course, folks that are wanting to access abortion care and folks that are desiring to continue their pregnancy. And so in both cases, I have most people who are accessing abortion care already have children. And so that is really important to know. And so for folks that already have children and maybe have used Medicaid for their last pregnancy, they're off Medicaid maybe by the time they're pregnant again, or they're about to be cut off. And Medicaid doesn't even pay for abortion care access at all. So they're very limited with their funds to like, where can I go? How can I access care? And then we have the reality that, like Shanette was saying, that folks do not know when they're pregnant. There are some people who, like Dr. Taylor is saying, they're tracking their periods. They're hyper vigilant, hyper focused on what does my body look and feel like when I'm ovulating so I can know. Then we have a subset of people, a group of folks that have been told they can't get pregnant, or they're having infertility issues because they have PCOS or X, Y, and Z. And so they're like, well, I can't get pregnant. And so then they're kind of like, well, I don't really need to track a period because when is my period even coming? There isn't a rhyme or reason to it. And so, and for all of these reasons, it makes it extremely challenging for Black women who, statistically are diagnosed with PCOS more than other races. And so you have these Black women in states that already have limited Medicaid funds, so they aren't insured to even go to the provider to get a pregnancy test or get a blood draw, because you can do the pee on the stick from the Dollar Tree, works perfectly if anybody just wants to stock up on those. But when you want accuracy and you want to like make sure, is this real or not, they're limited. Where can you go? Where can I get the care? And so it deeply affects people who are economically struggling, already have children, because most folks that are accessing abortion care have children. And then you put on that time constraint of, well, I just found out, but I haven't really been tracking my period because it's either irregular, or I thought I couldn't get pregnant, or X, Y, and Z, or I'm scared to track it because we all are on social media. We all have watched the news, and people are scared to track because they don't want their data being sent out and used against them. For that, I tell people to use a particular app. Okay. Stop using, can I say the name of the app to stop using? I'm going to say it. Flow. Stop using Flow. Okay. We're going to use something
Good
else.
to know. Good to
Yeah.
know.
So stop using Flow and start using, there's some other apps that don't send your data. Okay. So when you're able to better like be in control of like, or feel like you're in control of your body and like know what's happening, you can make better decisions or the best decision for you. And it kind of gives you a little bit of time, but it's still tough because you find out at 4 weeks or you find out at 5 weeks. I'll put it in the chat. You find out at 4 weeks or you find out at 5 weeks, then you're like, where can I go? Who's going to watch the kids? When can I take off of work? There are so many constraints that make accessing care really challenging for everybody. So I know I feel like I just went in a circle, but I know I covered a lot with what you asked, Dr.
Thank
Evans.
you. Oh my gosh, I'm loving. Yes, please drop the information because I'm constantly telling my patients, like, we're going to do whatever you feel comfortable. And it's actually really important that we know what apps we're even, this is political. This is a political statement that needs to be protected and kept safe. So thank you. Um, Wow, thank you, everybody. I think now we're going to open up the floor to some questions. I'm going to open up the Q&A. Let me just do the first question that I see. So I'm going to okay, so the first question is of to Shanette specifically about the status of the lawsuit seeking to hold the medical professionals accountable. If you feel comfortable, if you don't, please let us know.
Now, as far as the lawsuit, of course, that is a legal aspect that I generally don't talk about, only because they vet everything. And of course, I'm never going to say the wrong thing because what happened is what happened. But for the client attorney privilege, I'm not at liberty to really talk about that. However, I can give you one of my attorney's name and anything that can be talked about as far as the case, they'd be more than happy to.
All right, whenever you feel ready, no rush.
Okay.
And then the next question is going to be from a full spectrum doula practicing within the California jail and prison system, looking to get a little bit more into abortion training. Um, and I guess, in the Oakland area. So she knows some people that are kind of in that practice. But the specific two questions, this is just to everybody. What support systems are essential for providers working in these politically charged environments? I may want to just step in here because I think when I went to the Women in Medicine conference in Chicago this summer, and I went to a speaking event about emergency medicine doctors getting and kind of helping start to support abortion care, which I think if we look 5, 10 years down the line, this is probably where most of the care could be starting to be focused in. Because if the reality is, just like me, I knew there were states that I did not want to work in because I knew that I wanted to provide abortion care. So there will be deserts, but what is still there is emergency room medicine. And how can we ensure that we can get maybe medical abortions in safe care given by the ED? And there is actually one program in California that is doing that, and they are an ER that is giving medical abortions and is able to practice safe care. And if they have any complications, able to then refer up to OBGYNs and have a whole system in place. And so I think support systems look like, okay, instead of just forcing OBGYNs to then take the brunt of all criminal activity that can happen from things, start to spread it out to where access to care could look like in the future. So I would say starting to not only clarify the roles of ER doctors or these clinics that could help, but supporting them with actually providing medical abortion care. Anybody else have the question to what support systems are essential for providers working in these politically charged environments?
I would like to add, oh, I'm sorry, Dr. Taylor, go ahead.
Since it was a doula specific question, I'll yield the floor.
Thank you. I appreciate that. I think finding the abortion funds in the areas that you are trying to support, and even nationally, there are abortion funds all over the country, and those abortion funds have resources to all the other local abortion funds that are in the area, what abortion clinics are like safe and reputable to go to, abortion doulas and volunteers in areas that are willing to drive clients to and from clinics, sign the clients or patients in and out of the clinic if they need it, and also help with funding if that is necessary. So finding the local abortion funds is a great place to start. And then as an abortion doula, sometimes we fund abortions by leaning on our community. So people on my Instagram account know that I am an abortion doula. So I may say, hey, I am looking to, I have a client that needs $100 more towards their abortion procedure. And I'm fundraising money like just from mutual aid. So getting used to asking for support when you need it. So that's how you can build your community in your area.
And I was just going to add, we say that abortion is healthcare, but we don't act like abortion is healthcare, right? So, like, when you are someone who provides abortion or you are someone who supports an abortion seeker, people need to know who you are and so that they know that they're not alone. And then other people who are also care providers and supporters know who is who. Like we all are operating in these silos because of the fear, shame, and stigma that's been created by all of these hostile policies. And we know that more people support bodily autonomy than are the people who are the loud opposition. But the thing is, the conditions have been created where people don't allow others to know that they are a safe person to help them get what they need. And so, what I always want to push people toward is, you know, being a supporter out loud, letting people know that you exist and that you're safe so that we can so that we can break down these silos so that then we can be the support that we need to one another and and fuel the fight to make access to care a reality for the people that we're fighting for.
Yes, saying it out loud, saying that, we have had abortions before and we do them and we are going to do them with care and love and non-stigmatized. Clearly, I'm an abortion provider in California and Los Angeles if anybody needs me. I'm Dr. Evans. Okay.
Can I just add to
Yes.
just okay, so I live in Kansas and I just remember in 2022 when the amendment came about for the abortion ban. The city was just so polarized and I was amazed that the bill was passed to maintain abortion up to 22 weeks. And I live in a very conservative area. But you'll be surprised how, like, almost everybody came out to vote. We had over 1 million people that voted in the midterm election primarily for this. And on the opposite side of the state line in Missouri, it fell. I mean, it didn't pass. And so you have people who would come to Kansas and, they voted for the ban to be reversed in Missouri, and then they took it back. And it's just like been a back and forth with Missouri. And that just goes to show you that they are playing playing politics and, mental gymnastics with people's right to vote and what people actually want. This is not, if you overwhelmingly, how do these people change these laws when we know that even conservative people want to maintain this? And it's just like ridiculous what's going on in the United States. And that's why it's important for us to continue to speak and be a voice. I'm a teacher and I have students who have to have these procedures. Like when you're 16, 15 years old and you make a mistake and you have things that can change your life forever, as a parent, why can't I make the decision for my child? Or, whatever the case may be. It's insane. But I mean, I just wanted to add that because I live in a place where I see both sides.
Exactly.
Like you just go 5 minutes across the state line and you're in uncharted territory of danger. If your zip code, it doesn't match the opposite side. So I would just say that, send your people to Kansas if you can. I mean, because, they look at the Midwest like, oh, y'all backwards, but Kansas got it right when it came to that.
And there are little pockets like that. Chicago was where I trained and we would get people coming from all over. sometimes from Georgia, actually, to come get their abortions. And they would be supported by networks within the community. We would be able to put them up in hotels, keep them safe. We established care very early. Like it was a good thing in Chicago. So that's another place kind of in the Midwest that helps. We are almost close to the end of this panel. I just think we're kind of resource sharing right now. I'm loving this. I think if anybody can drop any resources in the chat about what community, and this is kind of like the last question of this doula. And I think maybe just putting all the answers in the chat, but are there any community-based models of care like emerging in response to these changing laws? So an example is the Jane Collective, which is an underground abortion service in Chicago. And I do think we need to go there at times. Like there is a role for underground care. There is a role for political care, and just being out loud and saying, I do this legally. But I mean, to be honest, are there any resources that people feel comfortable dropping in the chat, not only just to support either helping with financially, but what if those systems fall through and we really do need this kind of second line?
I want to answer this quickly to the doula that posted this. Find your local abortion doulas, okay? Find your local, see you later. So you have to go. I hope you have a good day. Um, find your local abortion doulas, find your local abortion funds, and from there you will build a resource list of all the people that are available. There are ways that folks that do the work that I do communicate to keep the people that we serve and their families safe and ourselves safe. So I'm gonna just say go find the people, local folks in your community. I will drop my Instagram in the chat if you want to DM me, and then I can share my number and we can communicate more. I'll just put my number in the chat and we can communicate so that you can get, build up your team of people.
One more question, Nandi. Someone asked, how soon can a client contact you for support in getting an abortion?
Immediately, as soon as they get a positive pregnancy test. If you get a positive pregnancy test, abortion doulas in most cases are trained to help you go through like the emotions of like how you're feeling with the positive test or the negative test, whatever you're feeling really, and then help you make the best decision and give you the resources. So as soon as they get a positive pregnancy test, tell them to call me.
Excellent. We love that. All
And if
right,
I could
everyone.
just really
Yes,
quickly before we
please.
end, these platforms and these discussions are extremely important. But what's most important is that we bind together because for some reason, these anti-abortionists, these politicians, they always have one up on us. But we have to be consistent. We have to bind together to bombard the capitals, wherever we're needed in order to make our voices heard. And often when I go to the cemetery to visit my daughter, I always hear these three words: don't stop, don't quit, keep going. And if we don't stop, we can get change. It may take some time. We may be kicked with no's, but at one point there's going to be an expiration date on these no's. We have to keep going because with the way things are going now, if we continue to let them make decisions for us, there are going to be more deaths. So we just can't stop. We can't quit. We have to keep going.
Absolutely. We must keep going. And thank you for reminding me. Thank you for reminding the people that are doing this work, because it's easy to get comfy. It's easy to say, you know what, this is too overwhelming. This is way above us. This is getting to look like this is never going to happen. And that's not true, because we're doing it for your daughter. We're doing it for everybody that is here. So thank you so much to everybody. Thank you for honoring our patients, the people that have gone through this, and happy Black History Month. Hopefully everyone can kind of stay in contact, and I think that kind of concludes our session today. Bye, everybody.